Hi friends, if you have COVID infection or you are infected with COVID or you are recovering from COVID and facing hair loss issues, you must watch this video. I'm going to share a lot of useful information with you guys regarding the management and reason of this hair loss. I'm Dr. Shail Gupta and I am a dermatologist and hair transplant surgeon who has been practicing for almost 20 years. So I myself had COVID and you know uh, post COVID, like any other illness, like typhoid, dengue, or some liver abscess or liver infection or any other illness, we see even during pregnancy, after delivery, we notice excessive hair loss, and it does not happen at the time of injury, at the time of problem. It happens after, say, around 2 to 3 months after the problem. So same is the case with COVID. So you will not notice excessive hair loss during COVID, uh, but you will notice it after 2 to 3 months of infection. This is because at the time of infection or any other injury, or stress, these hair enter into telogen phase, which is of 3 months. So these hair start falling after 3 months, and then it continues for 2 to 3 months, sometimes little longer if there are some other contributory factors like anemia or poor health, poor nutrition. So if you are facing excessive hair loss, and it can be very severe means very severe, especially post COVID, I am noticing a lot of patients are having very excessive hair loss and they are scared, and more so female patients, because of the length of hair. They are like kind of more scared because they see a big bunch of hair coming out, and this leads to stress, and stress again contributes to hair loss, so it might prolong your illness. So please don't be stressed. uh, had it not been COVID or any other infection, and you were losing hair without any reason at this pace, then it would have been a major problem. But because we have a justifiable reason, and we know the exact reason why these hair are falling, you should not worry much. So what can you do once you have this, once you have COVID infection, to minimize the impact of this hair loss? Or when you have hair loss, what can you do to improve and get back your hair? So role of diet is very important, and stay positive, that is also very important. There are some medicines also, there are some treatment procedures also, and lifestyle, exercise. So all these things are actually going to help you. So coming to exercise, very important, must exercise. You can do some asanas where head goes down, legs up, maybe wall stand, that improves blood circulation. Going out in sun, taking sun bath is very important. Vitamin D is very important for you. And when you take directly it from sunlight, nothing like it. There is no substitute to it. No medicine, oral sachets or whatever, is a substitute to sunlight. Be grateful to sun, for giving you life, for maintaining, sustaining your life, and be happy. Even after COVID, you are alive, you are taking breath, you are alive. Isn't it great? So many of us, lost their lives during COVID. So be happy, you are alive, that's good, more than enough. And exercise, then sunbathing, then stay positive. Do some affirmations. I'm sharing some links with you. You can try these affirmations, they are good. And I am a subconscious healer as well, so I make these affirmations. You can see the information in description. Now, role of diet, which is very important. There are some superfoods which you can have, and they really help. One of them is spinach. Yes, it is really great, wonderful. It is very rich in iron, and generally the plant-based protein which you get, it is easily absorbable and you get more out of it. So spinach is a wonderful food which you can have. I also take it, and you can eat it raw also if you can. Then the second food item is seeds. So you can add pumpkin, chia, flax seeds, or watermelon seeds, muskmelon seeds in your diet. Take a fistful of seeds. That's very important. Then you can add nuts, very important, and berries also. So this is a good source of protein and omega 3, and this is really good. You must take it. Then comes the role of citrus fruits. It is very important to have citrus fruits. Gooseberry is one of them. Amazing. I eat it daily once, and it is wonderful. Wonderful. You can add other citrus fruits. So many of them. Whatever is available to you, eat plenty of them. Like vegetables and fruits, must have them. Now, other sources of protein which you can have, then egg is very good, you can have it. Those who are like vegetarians, they can have tofu, that's a good source of protein. You can have paneer, you can have sprouts, so that is again a very rich source of protein and wonderful, beautiful, amazing. Then role of maintaining hydration is also important. So you can have coconut water, you can have lemon water, that is again very, and add salt to it, lemon water. Especially post COVID, immediately post COVID, you feel dehydrated. The skin is like kind of sagging, and you feel like the blood pressure also sometimes goes down. Not in those patients who take steroids, but yes, the other ones, it can go down. So please take care. Now, having said all this, now comes the role of some medications also. So there are some hair topical hair nutritions which you can apply, like some peptides, even procapil. These things help. I generally don't prefer using minoxidil in such cases. I give a hair nutrition which I have designed. It comes by name of Hair Art. It is wonderful. I am also taking it, and it has helped a lot of my patients to recover. Now, in cases where we see significant thinning, we can do PRP. So PRP is platelet-rich plasma, and it is a wonderful treatment done from your own blood, and it improves blood circulation and helps you in recovery. So PRP can be done like after say 1 month of COVID, so that it will reduce the impact of that shedding telogen effluvium, and it can also be done once the shedding phase starts, maybe 1.5 to 2 months when you are into shedding phase. So this is the timing of PRP which you should get done, and it's a small procedure and it works very well. So I hope this information was useful. Please don't take stress. I receive hundreds of calls daily where patients panic, and sometimes they start even crying that we are losing hair. And please be strong. Take care of your diet. Take care of yourself. Start doing some affirmations. Live in a frequency of gratitude because you are alive. Okay, there are so many people who were not so fortunate. So I hope this information helped, and please share this information with other people, your friends, your family, uh, whosoever is had COVID. So this will help. Otherwise, the diet which I have told you, those people who haven't had COVID also, they can also take this. And thank you. Love yourself and stay blessed. In case you have questions, queries, you can call us at given numbers. You can write to us. You can share your pictures and share your concerns with me and my team of experts. We'll try to resolve them. And thank you. Love yourself.